This is really stupid. You know, it's a bad habit. And here's what I'm going to talk about. Healthcare. Yeah. Bad fucking habit. And I shouldn't have done it. But I like it. Anyway, there's my little plug there, anyway. And, oh, I'm Ted, by the way, and I am living down to expectations, a member of the 47%. You got that? Another little video today. Probably be the last one I do for a while. At least today. But the thing of it is, there's another thing I say a lot, isn't it? The thing of it is, you know, my porch screen door is over there doing this. I put a, I can get my hand up here and see it. I put a bungee cord on it a few weeks ago so it wouldn't go bang against the chair. And my bungee cord has been stretched out. And it's banging again. It might bang in a minute. You hear the birds? I'm on the front porch. That's where I stay. That's a disgusting habit. I say shit and damn and hell, and I smoke little cigars, and I have I have a beard, and I have long hair, and I'm a real human being. So we're going to talk about healthcare. Just a couple of things. Yesterday, you know, I was on the bus, went to the VA, because the Veterans Administration is the only healthcare I have. And my wife has insurance, and I've said this before on the other thing I did about the 47%. She, to get on her insurance, it would cost about $400, $500 a month to put me on that insurance. And then you got the co-pays and all that shit, you know, and the deductibles. So, ain't no way in hell we can afford that. But I can go to the VA. VA is wonderful because the VA loves to give you pills to make you happy. They do. They, I read, a thing. Here it is, right here. I saved it. You know, it was on a website called johnrappaport.wordpress.com. I found it linked from somewhere. But it said in 2011, doctors wrote 4.02 billion prescriptions for drugs in America. That's an average of about 13 different pills for everybody in the country, man, woman, and child. I wonder if they consider the VA. Because here's the way the VA does it. The VA, I call the VA, and I've gone through four doctors. I'm on my fourth one. I had one, he was an idiot. I requested a change. I had another one, a bigger idiot. I requested a change. Got a third one. She was a good doctor, but she was retired, and sometimes she listened, sometimes she didn't. But she got me some medication that really worked, and then she retired. So I have the third dweeb, who is like the other first two, apparently. And so I saw this guy one time, and I have this like nerve thing. It's terrible. Hurts like a motherfucker sometimes. I don't take some pills. And if I do anything, that's why I sit on the front porch. But the deal is, I saw this guy like back in February, and That was when he first took over, right? First meeting. 15 minutes. How you doing? I'm, Dr. Plucky. And this is on healthcare. Don't forget that. And so didn't see him again. So the medication that my other doctor, she was great. Her name was Dr. Khalil, and in the Lufkin, Texas VA clinic, she was a good doctor. She'd send you for everything. But the pills quit working. The pain medication I was taking wasn't working anymore, and I couldn't do anything. I was like, I can't move. It hurts. So I called the VA, the clinic, and said, hey, I'm having some trouble here. And bam, that went to the door. And talked to the nurse. And the nurse, without even talking to the doctor, said, well, go up on your gabapentin. Next thing I know, I get a bag of pills in the mail. Okay. So I start taking more of them, and they still don't work. So I call the nurse back. I said, man, this still ain't working. I need to see the doctor. Something. And she says, okay, I'll talk to the doctor. So I get a phone call back. Doctor's going to give you a new pain medication. So they give me this, narco shit. And I tell them, don't send me no codeine, man. That fucks my head up. They tried that. So they send me something just as bad, And so I get that in the mail. Didn't see the doctor. Haven't seen the doctor yet. And so I'm taking this. And then one day I had some housework to do. And, damn, none of it's working. Can't fucking breathe. Call the nurse on the weekend. Tell them I need something. What does she say? Go to the ER. Right. We'll get back to that. And so she took all my information, she could tell I was like, I'm fucking dying here. I need to speak to somebody. Do something. And so she told the nurse, and the nurse called me back on Monday, and I was, kind of pissed at the thing, and I didn't bother to answer the fucking phone. I got crumbs on my computer. I didn't bother to answer the phone. So I got a voicemail. Guess what it was? More pills. I shit you not. Went up on one pill again, went up on the other pill again, take them both. Stay stoned. Don't bother me. Right? More pills. So now if I get up and walk across, on the yard or whatever, and the VA just wants to plunk them little pills. Put my hand over and see, plunk them little pills down my mouth. Fix that problem. Healthcare sucks. That's the point. That's why should you give a shit, right? You're old, you're gonna die, the VA figures that, they're gonna keep you, they're gonna do what they have to do so that they don't get in trouble with somebody, and they're gonna let you grow old and die. And that's what it is in this country. That's what it's fucking like. That's what Mr. Romney, man, I'm really beating his ass up, ain't I? Of course, the other guy ain't much better. But that's what they say up there. They say, in their head, the corporate bastards up there, they say, these people are not useful anymore. They're 47%. They're moochers. They're leeches. They're not productive. That guy's no longer working. He's not driving a truck or sitting behind a desk or any of the things that he used to do. He's not paying taxes, so he ain't worth a shit. So our, healthcare don't fucking matter. And then old Rom dude comes out on 60 Minutes this past weekend, and he says, this guy said, hey, don't you think those 50,000 people out there that don't have healthcare should have some healthcare? You know what he said? Did you see that on 60 Minutes? He said there is health care for them. We take care of them. Somebody has a heart attack. This is what he said. Somebody has a heart attack. You call an ambulance. The ambulance takes them to the hospital. They don't let them die. They have health care. Is this guy, really here? Let me tell you, rich guy who don't have a damn clue what it is about healthcare. Disgusting habit. I know. We people out here, we 47%, who depend on programs such as the VA, and poor folks depend on Medicaid, and a hell of a lot of people who don't get Medicaid, they're in that little space there, they don't get Medicaid, and don't have health care with their employer. And let me tell you, Mr. Obama, sir, just making sure everybody has insurance ain't shit. Because my wife has insurance, and she can't afford to go to the doctor unless it's serious because of the damn copays and because of the damn, deductibles. She can't go. And that sucks. I said, go to the doctor. I ain't going. And she's paying for that shit. Like $200 a month or something out of her check. And so Mr. Romney says, go to the hospital. Go to ER. I wonder if he's ever done that. I wonder if he's ever been, oh shit. If he went to the ER, they would shove everybody out of the damn way and haul his ass in there, and he would be in and out that quick. And paying for that bill, he would not even have to worry about it. Of course, he could probably bring his own doctors to his house. Shit like that. He don't have to go to ER, and he sure wouldn't go into the ER down here, in a county hospital, in the backwoods, because he had to rub shoulders with us 47% people. But if you haven't been into an ER lately, it's a real pain in the ass. A lot of times you have to sit there a long time. You can't take your kid to the ER with the flu or cold. You can't take your kid to the ER if they fall off the porch and bump their fucking arm, because that's not an emergency, and you sure as hell can't afford it. If you take your kid up there, they're not going to do anything. They're going to look at it and say, that's bad, and they're going to send you home. So here's my experience with the ER. When I first started having trouble with this damn shoulder back pain thing, whatever the hell it is, it was cute yesterday explaining to that other doctors, a dozen fucking times I've told these people what I go through, and they all look at me like, huh? But anyway, the first time, is what I said about that codeine, man. The first doctor I had was an idiot. He wasn't even a doctor. He was a PA. And he said, I come in there and I said, it hurts over here. And he thought, he's got muscle strain. So he sent me this big bottle of muscle relaxers. And he sent me this big bottle of codeine. And he says, there you go. Fix your problem. Well, muscle relaxers, they didn't help. The codeine, he got to be, it made me nuts. Crazy? I ain't kidding you. I know you think I'm crazy right now. I am. But I was nuts then, buddy. I tell you what, it was one day in September of, what was it, 06, I think? 07, something like that. I forget. It's been a long time ago. And, man, I started getting, like, paranoid. And I'm like, crap. I am going to fucking die. I'm dying. I am dying, people! And there was this one day I had this weird headache. It was like strange. And I was like looking out into this weird world, and I could see that Grim Reaper coming at me. I could see that hook. And I told my wife, I'm dying. You gotta take me to the hospital. There's something wrong with me, baby. I am so dying. I'm telling you, I was like, I was not a John Wayne man that day. I was bawling. I'm dying. I was telling my kids goodbye. I kid you not. And I was all freaked out. And they took me down to the ER. It's kind of funny. It really is, because I was like fucking freaking out. And they took me down to the ER. And I went in there. And I go, and they did they put me in a room, and the nurse comes in there, and I'm saying my head hurts, and it's like, I think I'm dying. I don't know what it is, and it, so the nurse comes in and hands me one of the gowns. She says, take your clothes off and put the gown on, and I took my shirt off, and I wouldn't take my pants off, and she said, oh, come on, take your pants off. Why are you not going to take your pants off? We need to examine you. I said, I have problems up here, not down there. And you're not, you know why? Because I was at the hospital because I thought I was dying, but I was also thinking, if they're going to try something I don't like, my ass is out of here so fast, and I'm not running out without any pants on. I kid you not, man. That was it. I did. I ran. I was going to run. They gave me a ultrasound, and my blood pressure was kind of. Sorry about that. Notebook. And it was funny. Looking back, it was funny. It was scary as hell when I was there. It scared my fucking family. They didn't like me being nuts. I finally got off that shit. But bad health, bad stuff. So anyway, I don't deserve health care because I have bad habits, right? Alright, anyway, back to my story. It's funny. So the doctor come in there and he said, we're going to try this test. And I said, how much is that going to cost? This is going to cost this much. And I said, no. We're going to try this other test, MRI. I said, no, you ain't putting me in one of them things. So, he told me to go home. And I went home. And he said, go back and see your doctor in a few days. So I went back to the VA, and guess what? The son of a bitch at the VA never, as far as I know, ever even called the hospital to find out what happened. Ever. I went over there to tell him about all this stuff. I said, I was like paranoid and stuff. I don't know what's going on in my head and all this stuff, and I'm having pain. I'm having this weird pain, this headache and all this stuff, and I go to the ER and they do tests and everything like that, and they talk to me about it, and I told him about it, and they never got the records. So when I got hurt in here, a couple weeks ago, called the VA nurse on the weekend. She says, go to the ER. Yeah, right. What for? They're just going to see me and send me back home. They don't have time to analyze what I'm doing. They're sure as hell not going to treat it long term. So all I'm going to do is go up there and do what I did then. And do you know what I did then, Mr. Romney? I ran up a bill. What was that bill? Hell, I think it was $8,000. 2-3 hours. That's the health care Mr. Romney's talking about. That's the health care the rich people think we have. We don't need Medicaid, Medicare, VA. We don't need any help because we can go to the ER. We can go to the ER. If we're not dying, we can't go to the ER. And if you haven't been going to somebody regularly and getting regular treatment when you're, old fart like me, you need to go get, because, VA pills. I take pills, for blood pressure. I take pills for cholesterol. And I do okay. Because I have it. A lot of people out there, they're fucking dying every day because it's too late when you have a heart attack. That's life for the 47%. That's life in the healthcare system. That totally fucking sucks, people. So, hey, get real. You know what I mean? That's the way it goes. Give a damn. Alright? Just give a damn. That's all.